So the Rural eMeds program is actually aiming to achieve to get the eMeds application, which is part of the EMR, out to all of the rural sites in the 6 LHDs that we're covering, which is Northern, Mid-North Coast, Murrumbidgee, Southern, Western and Far West. So that all over 113 sites will actually get eMeds into their facilities. I think the real benefits are the fact that we can actually see the medications that a patient is actually on between one site and the next. So there's an ease of being able to transfer a patient within those rural LHDs and see what's actually been going on for them. And it also saves a lot of the transcription error risk by having to rewrite stuff. It's actually already in the system, so a lot of the doctors can actually just pull it and reconcile it across to give the patient really the safest medication list that they can. So in terms of the change management aspects of it, we've probably changed the way that we do things a little bit, and we've worked on trying to get the clinicians involved very early on as we were trying to build the final product. And the reason for doing that was to get them to see the workflows, understand the ones that would impact on them, and perhaps look at their own workflow practices as well. And then to take it even further than that and to realise they were part of the solution. And so that's made the build a lot easier, but it's also made it a lot easier in terms of then putting it into the hospitals because they've been part of the process of getting it to that point. Well, at the end of the day, the clinicians are the end user. The patient is the receiving end user in terms of the impact on them. So the most important thing is to have the clinicians very comfortable with using the system so they can make it as safe as possible. At the end of the day, the system doesn't actually dictate their practice. It's up to them as a clinician to continue to work as a professional, but it's there to try and enable their workflow and also to enable some additional safety for the administration, prescribing and the use of medicines in an organisation. Look, the benefit of attending here, I think, is the fact that it covers such a wide, diverse range of topics. And, you know, like we're doing digital health here, but there's all the other work streams and flows that are happening at the time. And also it's an opportunity then to bring a lot of different people into the expo space. So we get a real chance to see just what's actually happening out there, not in health IT, but just in terms of even infrastructure for health organisations.